Hey, happy Monday noon. Dr. Alan Christensen here with you for Office Hours Live. Good to see you guys. I'm with you on Instagram, on Facebook, and on YouTube, and I'm seeing a lot of folks jump on already. Hey, good to have you. I had a couple of really good questions sent in advance, and one of those I think is worth talking through in some detail. So I'll start with that. But otherwise, I'm here for your good questions. And Office Hours Live, thyroid, hormones, weight loss, those are the top topics that top topics. Those are the main ones that I'll cover that I can give some useful answers in. And good to see you all. What I'd love to do with these is give more detail than you would likely hear otherwise. So put a good question up, throw some detail in that, and hang out. I commonly have follow up questions, and that's where we really get more than you would find by just randomly Googling stuff. So good to see you guys and hope all is well. We're nearing into the holiday season here. So here's one that I got that I wanted to talk through with you guys real quick. Oh, where was that? Here was the question. So this is from someone who went on the thyroid reset diet and cut out iodized salt and saw her thyroid function do better. But then she saw things start to worsen after a little bit. So apparently her TSH elevated somewhat. And she talked about avoiding salt being important. I just saw a question come in on Instagram about pink Himalayan salt. Yeah, thank you for that one. Briefly to respond to that, because that fits with this one too. Pink Himalayan salt, the only assay that I've been able to get on that was confirmed to be accurate by some manufacturers. And I ran the math. It has twice the iodine as just Morton's iodized salt you could buy in the supermarket. So it's not a low iodine option, unfortunately. But yeah. Okay. So back to the question that was sent in. So here's her scores. I'm sharing these. These can show up on a couple of the platforms. Basically, her TSH, it went to 3.6 and not sure what was going on. So let's get some context on how much iodine someone might need and what else could cause these scores to change. And I saw a follow-up content in the pink Himalayan salt. So hang with me for a brief aside, you guys. I used to use a lot of sea salt, and my thought was, you're getting some more minerals. It's a natural thing. And then I looked at a lot of the assays. So you are getting a lot more minerals, but if you look at the assays of many sea salt products, a lot of those are minerals you don't want. Lead, mercury, gold, cadmium. These things are not there in high quantities, but they're there. And the minerals you do want are there, but they're not there in high quantities either. So in the case of potassium, for example, sea salt's been talked about as a source of potassium. Well, it has it. And if you do about 300 servings of it per day, you'll get a couple milligrams of potassium. So yeah, it's just not really a multivitamin. So I think more about salt as something that does your flavor. It works well in cooking. So I just like pure ones more than anything. I'm seeing more good questions come in, you guys, and I'm going to hold on to some of these. I'm seeing one about stopping cravings, and that's a good one. I'll come back to that one. So, what was up with this score changing? Well, she said that she was using the chocolate daily reset shake. It wouldn't cause those scores to go up. So, let's give some quick context. So, overall, the World Health Organization has said that people are safest between somewhere around 50 to 200 micrograms of iodine per day. And yeah, if you're using iodized salt, you can easily get a fair amount more than that. Regular iodized salt, like just Morton's brand, you'll get about between 3 to 400 micrograms per day if that's your main salt. If it's pink Himalayan, it can be twice that. So they can take you well above that target in just no time. And we think about how much our needs are a little more detail. So if you're on thyroid medication, you may want to be staying below somewhere more like 50 micrograms per day because you're already getting a lot in your medicine. And if you're not, but you have thyroid disease, you think more like a window of about 50 to 100. And there can be some surprising sources. One big paper showed that of adults in America right now, it's a little different per exact age, per gender, per ethnicity. But for most populations, somewhere around 30 to 40% of people are shown to be at unsafe levels. They're shown to be getting too much. And this is a thing. A lot of people can tolerate extra and not have any complications from that. but they're not the ones who are prone to get thyroid disease. So those who are, this little bit extra is enough to cause the disease or to worsen it or to keep it from getting better. So it's critical to get below this window and identify all those hidden sources. And here's one of the ones that shocks people the most. So the gal that wrote the question, and it might be as simple as one's cosmetics. Conditioner is one case in point. So what we see is that uh, average levels of PVP in conditioner can be somewhere around 0.5 to 3%. Well, PVP is 12% iodine. And if you're getting a dose of conditioner that's like 12 grams, that can end up being about 200 to 1600 micrograms of iodine right there. And related question, one that popped up, is there a blood test for iodine levels? Now, the person that wrote in this question, I looked over the labs that she sent. They were in this image here. And she did have a blood test for iodine. She had a urine test. There are blood tests, but iodine, we want to evaluate it in different ways. There's iodine as a toxin and iodine as a nutrient. So as a nutrient, it's going to be in one range. As an overt toxin, it's going to be in another range. So you can have an excessive amount as a nutrient, but that's not the same as it acting as a toxin. So iodine as a toxin, the only real relevance of that is people who have had a lot from a contrast agent or from a medication like amiodarone. And in those cases, there's so much in the body that we can't get it all out in the urine quickly enough. That's the only time the blood levels go up. So the blood levels don't go up or down when your iodine is within the range of it as a nutrient. Whether you've got too little, too much, just right, the blood levels don't predict that. They only become relevant when you're at a range so high, it's starting to damage your kidneys. Now, there are urine tests for iodine. However, they're only accurate if you test yourself a lot. So, no exaggeration, if you test yourself 10 times, you could be within about 80% range. But the real question is it helpful to test? It's really not. So, in the Thyroid Reset Diet, I shared some pretty cool studies in which 78% of people fully reversed thyroid disease just by regulating iodine. And what they did is they looked at the urinary levels of iodine before people went on the diet. And it turned out the urinary levels didn't predict who would get better and who wouldn't get better. So the question is, would one say that if I've got a high level of urinary iodine, then it could help to reduce it? But if I don't need to. That seems logical, but that's not how it works. So yeah, whether your urine levels are high or not, it doesn't change the likelihood of improving your thyroid function. And that's because the iodine in your thyroid is not the same as the iodine in your urine, and it's not the same as the iodine in your blood. There's no way to really test the iodine directly in the thyroid other than lower your amounts and keep tabs on your function. Now, if you have lowered iodine and your thyroid's not getting better, one thing you could troubleshoot is to see if there's some hidden iodine still getting into your body. And that's the one case where tests can be helpful after the fact. So, yeah. And in this case, another question is, why else could thyroid labs fluctuate? Why else could Herbie scores be going up and down? And there's a lot of reasons. There's a lot of reasons why that can happen. I'm seeing more folks jumping on. Joanne's here. Hey, Joanne, good to see you. Walnuts, Joanne, if you want to put some more details on why walnuts would be an issue, I'll certainly address that. Glenn is here. How you feeling? Still just naps? I'm recovering from West Nile as well. Oh, wow, Glenn. Yeah, I'm sorry to hear that. I hope you're doing well. I don't know if you actually had meningitis from it. I sure hope you did not, but it can sure be a big deal. I don't know how severe that was for you. I'm doing fine. What I do notice in normal operations, I'm 100%. I just came back from a brief trip to help my mother move into a care home in Minnesota. And it was me moving a whole lot of stuff by myself for a couple of days. And it was a really busy trip. And I don't know, I think there's some things where you're going to get tired anyway. So I'm not totally sure if I would have been wiped out regardless, or if I'm still getting a little tired when I push things hard. It's hard to gauge that, but I don't know. It's a small difference. In any case, I feel fine or within a stone's throw of totally fine. So thank you for that. So back to why else would thyroid labs fluctuate. So lab variability. And even when you do labs perfectly, there will be a certain difference from reading to reading because they're not flawless. That can be as much as a point of the TSH for scores in the normal range, like the readers were. Disease progression, one can have problems with malabsorption. There's a lot of ways in which the test timing may not be consistent. So if someone tested one time when they were mid-cycle, when they were menstruating, and then end of cycle. So based on your period, that can change your results if it's not consistently done. Biotin, if you take biotin a few days before your test, that can change that. Medication substitutions. This is one that surprises people, but your pharmacist can fill your medication with a substitute, even if your doctor asked them not to. And sometimes a substitute won't act the same way. So if ever you refill your medication and now your scores are different, that's one thing to consider. That can be a possible culprit, is just a random substitution that you weren't expecting. Okay, so back onto getting my other comments back up here. Yeah. So back to the comments about the testing. So the creatine to iodine urine you mentioned in past podcasts, Aesthetic Love. Yes. So in terms of testing, that's probably the most accurate. And what happens is how much iodine you pee out varies completely every time you pee for reasons that are pretty random. There is a relationship, though, between how busy your kidneys are at that moment and how much iodine comes out. And so the creatinine, the iodine to creatinine ratio, that does help to make more sense and does make it a little more accurate. However, even that test doesn't predict whether or not you could benefit by reducing iodine. But if you have reduced iodine and you've not seen your thyroid improve for several months, that's a helpful test to see if you've reduced it enough or if you're still detoxing. So it's called urinary iodine to creatinine ratio. And many labs do offer that as it is. LabCorp, your doctor can order that. You can self-order that in some areas. There's an online lab called ZRT Labs, as in Zulu Romeo Tango. They don't pay me. I'm not connected with them, but you can order their test directly in most states, and they do have a urinary iodine to creatinine ratio test. It's just called their urinary iodine test. That's the only one they have. So with that one, it does give that ratio. Now, if your ratio is under 100 and you've been reducing iodine, then you've been doing it effectively. If you're still above that, there may be either some hidden sources getting into your system, or maybe you need longer to detox because there was so much coming into your body. So that's the one time in which it's useful, and that's the one way in which it's probably accurate. And Kelly's here with us. Hey, Kelly, welcome. I'm with you guys on Facebook and on Instagram and on YouTube. So really happy to be with you guys on a couple platforms right now. And several good questions. I'm going to get to more of these as we go. I'm just getting caught up and waving to a lot of new friends that have come on. And I also love to stick with follow-up comments to go deeper when I can. So Nori, we've been talking about the salt and iodine. So nori is kind of a funny name given that's the sea vegetable. It's actually the lowest in iodine amongst sea vegetables. A sheet of it that you would make a bunch of sushi rolls with is typically around 50 to 100 micrograms. And the targets I mentioned before about being in that 50 to 100 range, everything has some. So every source you add in that has a lot makes it hard not to get too much. But you said you needed 10 grams of salt today due to dysautonomia. So here's the thing, is that there's a lot of great salt options that are iodine-free. My very favorite salt option is Diamond brand kosher salt. That's one of the only two products where if you read the ingredient list, it's just salt. The cool thing about it is that there's a shape to those crystals that makes it work really well in cooking. So it's different because of the physical shape, but it's completely pure. And that's a great one. There's other brands of salt that have no added iodine, but sea salt, with the exception of Celtic brand light gray salt, other versions can have a lot. So yeah, those are some good ones. And then Maldon's, Maldons, that's also a flaked sea salt, but I've seen consistent assays on that showing it's negligible in iodine. And that's a finishing salt. So you sprinkle that on stuff when it's all done. And there's not that much actual mass to it, but it's crunchy and you get a pop of flavor, and it's really good stuff. So, Joanne, I'll watch if there was more details about walnuts. Now, Joanne, I don't know if that might have been on some crazy extensive list of goitrogens. So there's a large number of plant compounds that can theoretically act like goitrogens. And in areas that have endemic goiter, a high intake of those foods can cause goiters to be slightly more common. But this is a big thing of geography. Outside areas of endemic goiter, where goiter is not common, those foods have no adverse effects. And I have seen walnuts in a few of those lists. I can't think of why else walnuts would have been considered that way, but I wouldn't worry about them. They're actually one of my two, I don't know, for a lot of different reasons, they're one of my favorite types of nuts and seeds. So they're good foods. Wouldn't worry about them at all. I want to see the follow-up comment. Okay, so Glenn, thankfully you did not have meningitis. It was the worst illness ever. I do feel 90.9% better now. I feel fortunate. No, it could have been much worse. Glad you're feeling better. Yeah, Glenn, are you in the Phoenix area? West Nile is rare, but it's been really common here. You know, a lot of my medical friends have said that the ERs and ICUs over the last few months have just been full of nothing much more than COVID and West Nile. So it's been a crazy outbreak of it in the Phoenix metro area, in the Maricopa County area. Okay, so here's a great one. Ascetic Love again. On the reset diet, you mentioned eggs can be high in iodine due to chicken feed. If we eat eggs from local hens that aren't fed fish meal, is egg yolk okay? I don't know. I wouldn't know without an iodine assay. I would expect that, but it depends what else they're getting, and I wouldn't know for sure. You can get iodine assays done. They're not all that expensive, but I wouldn't know the variation from batch to batch. You know, honestly, my approach would be use the egg whites, enjoy those, and when you're actively helping your thyroid work better, do avoid the yolks during that reset phase. Once you've achieved your goals and things have stabilized, and we're seeing this so much. We just had someone else write in who had about a decade and a half of weight struggles. You know, her weight just wouldn't budge. And being on the thyroid reset diet, she saw a small change to her thyroid function, but the way her thyroid worked changed dramatically. And this is the thing, this couple of really big lessons I want to share with you guys. Thyroid medications don't work the same as your own thyroid hormone. We see that a lot with people. So their glands work better and their scores, and they need less medication. Their scores might not change radically, but their symptoms can. And we see this over and over again. So that's one of the big ones. The other one, which goes with that, is when you're on medicine, your scores are helpful, but it's important to know what you're making because your hormones are more important. So, yeah, as your function comes back again, people commonly see improvements that they didn't get before from medication. And that's the cool thing about that. So when you're on that active stage and you're working to feel better, I would just be cautious and I would avoid things that even could be possible outliers. The drawback about having things that might be okay, might not be okay, is you just don't know what's happening. You know, if you got some good results, you wouldn't be sure which changes helped them. Or if you didn't get results, you wouldn't be sure if the diet just didn't work or if it was because you didn't do it 100%. So I always say do it 100%, you know, get the results you can get. And once you've gotten there, I actively advocate in the thyroid reset diet to go on a maintenance stage afterward. And egg yolks are rarely exorbitantly high in iodine. They have some, they have enough to make the reset impossible, but they rarely have enough to set you back once you've stabilized. So they're what I call a yellow light food. And during the maintenance stage, after you fix things, you're welcome to add one or two of those yellow light foods every day. And you probably do fine with that. So yeah, aesthetic love, I would just put the eggs on the back burner, no pun intended, until after things have stabilized for you, and then it would be a lot less to have to worry about. All right. So lots of good questions rolling in here. Let me take a peek at some of these here and stay on top of them best I can. I'm just taking a look at a couple different platforms. All right, so now here's some more questions on Instagram. Do you recommend taking methimazole spread throughout the day or at one time 10 milligrams? So, at a pretty low dose of methimazole like that, once daily is often adequate. That's used for Graves' disease most commonly. And I think I did see a question from someone too asking if the diet can work for Graves' disease. Now, I've had a lot of people write in and say that they've done the thyroid reset diet and had their Graves' disease get better. So there is that level of evidence, and there are a lot of reasons by which that would make sense, but there aren't the large studies. There are many, many large studies about the thyroid reset diet helping with Hashimoto's, hypothyroidism, and subclinical hypothyroidism. And of course, I've seen that as well. But I just want to say what level of confidence I have. Now, there is strong data with Graves' disease. There's having the autoimmune Graves' disease, and there's being hyperthyroid. Those things don't always go together. So once someone is on enough medication to slow the thyroid, at that point, then being low in iodine can make things go a lot more quickly. And what I mean by that is it makes it to where you wouldn't need treatment as long and you wouldn't need as much treatment. That can also be true for toxic nodular goiter. And those are the two main reasons someone would be on methimazole. So it can definitely make a big difference, but I wouldn't do it in place of things to slow the thyroid. And I'm seeing more details. So autoimmune Graves. Yeah, so definitely that's the case then for reducing extra iodine. And autoimmune Graves, it's kind of an odd thing. The autoimmunity by itself makes your thyroid think it's being told to work when it's not being told to work. And so it dumps out all this extra hormone. Now, that extra hormone causes one to be in a hyperthyroid state. That hyperthyroid state, one of many things that it does is it raises inflammation in the body. And that worsens the autoimmunity. So hyperthyroidism worsens the autoimmunity, which worsens the hyperthyroidism. And that's called the hyperthyroid autoimmune loop. And once someone gets out of hyperthyroidism, if they're lower in iodine, their odds of having full remission from Graves' disease are upwards of 95% over an 18-month time frame. So Graves' disease is more dangerous in the short term than Hashimoto's, but with good treatment, the remission rates are actually higher. That's not intuitive, but that's how it plays out. Looking at a lot more good questions here. So here's another one on Instagram. This is from Kim. Can DHEA cause hair loss? I'm on compounded progesterone with DHEA in the capsule. Boy, Kim, it sure can. So DHEA is dehydroepiandrosterone, and this is a androgenic-like hormone that the adrenal glands make. Now, for men, of course, if we have too much androgen, that can worsen our head hair thinning. DHEA is not a strong androgen in men that does that, but in women, it's very powerful for head hair thinning. As a generalization, that's going to be more so in specific androgenic areas. It can be diffuse as well, but it really commonly does do that, Kim. A couple of thoughts. I don't see DHA supplement. It's not something I really use that much. I did in the very distant past, but I came to realize that if it's lower, it's because the adrenals aren't working right. And what I found was that some of the simple stuff, like in the adrenal reset diet, very commonly gets them back to normal and back to functioning again. And sometimes it can be beneficial in terms of symptoms to take it in supplemental form. But here's the story again. What your body does by itself is not the same as taking it. So making more DHA inside of yourself is not the same thing as taking DHA supplements. They're different things. And I think we all know that intuitively. But hair loss is a super common side effect from DHEA. Progesterone can be sedating. Some can find that it makes them gain weight. Some can get bloating from that, but it tends not to be an issue for hair loss. But DHEA really commonly can. Another quick thought, Kim. So DHEA and progesterone compounded together. Progesterone is a hormone that you wouldn't take throughout the entire month. If you were cycling, you would want to mimic the pattern of your menstrual cycle. And even if you were menopausal, it's one that wouldn't be taken on a daily basis normally. DHEA, however, is taken on a daily basis when it is needed. So it would be odd to have those together because, one you'd need all month, one you would not. So just some thoughts on that. So I've got a lot of really good questions. Let me just try to see if I can find comments that are related. Um, How safe are HGH injections for someone who is a female, 40 years only? This is an interesting one too. And I'm proud to say that my views have evolved over the years. There's an old joke from an economist who talked to another one, saying that someone was confronting another one for changing their mind. And the response was, well, when I'm presented with new data, I change my mind. What do you do? So it's healthy to have your views evolve. And there was a study in 1995 done by a Dr. Rudman, and he gave a group of aging men who didn't have pituitary disease, he gave them growth hormone injections. And they did better in various subjective ways over the course of a few months. It was a preliminary study, and it was interesting. Seemed encouraging. Well, that really launched the excitement about growth hormone as an anti-aging treatment. And in the following years, there was a lot more that we learned about the relationship between growth hormone and cancer risk. And it turns out that it probably can cause people to feel better in some ways, but there's no reason at all to think it would make someone live longer. And there's a lot of reasons to think why it could raise disease risks. Now, there are people to where they have a pituitary disease. They're actually not making much of anything from their pituitary. Maybe the pituitary was irradiated, maybe they had an adenoma that was removed, or maybe there's something just crushing the pituitary inside. And there certainly are cases to where there's a legitimate need for growth hormone. The body's just not making barely any of that. But the normal decline of growth hormone with aging, I personally wouldn't take growth hormone for that. I know doctor friends who were advocates of that for themselves and for their patients. And one was a dear man, I won't name him, but he died very young from a rare brain cancer. And it's a type of a cancer that's known to be more common when there's high levels of growth hormone. And he was taking high levels of that. Now, it's totally true that it could have happened anyways to him. It may have been just a fluke or a coincidence. But I don't know. I always think that when it comes to health, you want to be cautious. We don't get do-overs. There's an asymmetry between something that might help and something that might be risky. I take the risks a lot more seriously because, there's limits on how fast we can get better, but there's no limits on how fast we can get sick. Things can happen really quickly. And I just really am risk averse in a lot of ways. Okay, so I'm seeing some more fun questions pop up. A lot of really good ones, you guys. Thank you so much. We got a good group with you guys on Instagram and on Facebook, and a bunch coming in on YouTube as well. And let me just peek and make sure that I'm not ignoring any other questions. Let's see. Here's a little more detail on a passing that I mentioned, and this is from Lori. Has anyone found hairspray, shampoo, and mousse without iodine-containing ingredients? Now, Lori, I've thought about this one a little bit. Now, those are things in which, specifically those items, the amount that you would likely absorb. So the hairspray, definitely. The shampoo and the mousse, well, so hairspray, definitely. The amount of that you use, as far as how many grams of hairspray come out of the can, and then how many grams come into your body, it's pretty down small. So yeah, hairsprays and mascaras, they often have iodine-containing ingredients, but I've run the math on that. The amount that you would actually absorb is just trivial. It shouldn't be a big deal at all. But I would think through your mousse, and I would think through your shampoo. The most worrisome things are going to be the conditioners and the face lotions and the body lotions. But anything you use a big glop of, like you just use in larger quantities, I would think about. And Lori, I'm welcome to feedback on this because there may be a lot of products I've not seen. And I didn't look, in all honesty, a great deal of depth with mousse products. So I'm completely ignorant about that. But I did scour a lot of shampoo products online, popular ones. And what I saw was that a little more than half were free of all iodine-containing ingredients. So you shouldn't have any problems that way. And a little more depth, that earlier slide I mentioned about PVP, polyvinyl pyridone, as being one of the main ones, it's not the only one. So I did put a fuller list in the Thyroid Reset Diet, but the main things are PVP and then kelp extracts or seaweed extracts. They're actually the same thing, but a lot of natural products call them kelp extracts, and it sounds more natural, but it's the same thing, and it's got a lot of iodine in there. So yeah, I don't think you'd have too much of a trouble finding some free of that. And I see a reply here. Uh, Someone said bostagal.care. I have seen a lot of products that are free of iodine for personal care products. If you check around a bit, you shouldn't have too much trouble finding some. There was a lot more carrageenan in foods and in natural care products in past years, but due to a lot more consumer awareness, that's pretty much gone by the wayside. When I first started the manuscript for the Thyroid Reset Diet, I did list a lot of brands of dairy substitutes that did or did not have carrageenan. And then as the manuscript was almost done, I went to some stores and just double checked, and like all these brands didn't have it anymore. It's pretty much disappeared. So that's helpful. That makes it easier. Um, and here was one. I was on Armour 60 milligram. Other than a little stomach issues, it was fine. Doctor put me on NP 60 milligram. My blood pressure tends to go high at times. Don't have that with Armour Thyroid. This is from Isila. I'm sorry if I'm not saying it quite right on YouTube. Yeah, so Armour 60 and NP 60. So these are brands of natural desiccated thyroid, also called NDT for short. And you'll hear about their potency both in terms of milligrams and also in terms of grains. Now, all products are the same at the level of grains, but not all products are the same at the level of milligrams. So those two are. So you got the same thing, but there are some that come like 65 milligrams. Well, that's the same as a 60 milligrams. So I talk about those in terms of grains because that's the most consistent unit throughout manufacturers. So those are both 1 grain potencies. And stomach issues, blood pressure, they are the same active ingredients. They are not the same inactive ingredients. And with thyroid medication, the inactive ingredients can change how it works in your body. It can change how it absorbs, and it can therefore have an effect upon what the dosage is. Isla, in general, I would encourage you to stick with a brand. If Armour worked better, I'd just stick with Armour. There's no drawbacks to it. But keep tabs of your blood pressure. Other things could be affecting it. But yeah, no reason to change. NP has had availability problems. Armour has not in the recent past. And they've actually got a large study they're about to publish in the near term. So I think that they will have a stable supply chain moving forward. I would just stick with Armour in your case. Yeah, so Kieran just put up a list of ingredients to look out for in the personal care products. That's great. So follow-up questions. We get a few more follow-up questions. Keep finding WP thyroid not available. Where do you get it? So WP thyroid less and less available. There is a compounding pharmacy. This is Mesa Professional Compounding. I'm not paid by them or connected with them. They do have the raw materials of WP, and they do compound that in a pure form where it's just that and sodium bicarb, aka baking soda. So that's a good option. They do ship to all but 1 or 2 states in the US. So you just have your doctor send to that. But yeah, a Mesa Professional Compounding Pharmacy is an option for that. And I won't put too much time into this one, but I have a lot of concerns as a generalization about compounding in thyroid meds. But in this case, for NDT and their pre and post testing process, I do feel confident about it. So yeah. Okay, related ones. Just read your article on magnesium and testing RBC magnesium. Read that blood is to be collected in a certain way so the blood cells are not falsely increased. Insert the needle. I've not heard that before, but in all honesty, there are a couple of different labs that will do RBC magnesium. I know that anytime they're analyzing red blood cells, they can't use the smallest needles. Sometimes the very small needles can cause a damage to the red blood cells as they squeeze through. So sometimes larger needles are needed, but the collection requirements for those test kits, they specify that. So that's not the sort of thing that you would need to be aware of as long as the person drawing the blood is. The simplest thing is if they're used to doing the test. If this is a place that has not done that test before, it might be worth just making sure they are following all the directions. But I really hate having people to feel a need to second guess their practitioners because there's like no limit to how far that goes. So yeah, if someone's doing the test and they've done it before, they're used to doing it, you'll be fine. No worries that way. There are standard labs that do run RBC magnesium, and there are some specialty labs that do it. But that's the most useful way to know if someone is unusually deficient. That's rather rare. Most people that do get good amounts dietarily and reasonable amounts in supplementation, they're usually going to be okay. But there certainly are cases, like I mentioned in that blog, of those that they're trying and they're just still really low, and it takes harder efforts to build them back up again. So if someone has had unresolved muscular pain, that's the kind of thing to think about with that. All right, I'm jumping back and forth from questions here because there's a lot of good ones coming in. I'm looking back to Instagram here, and I'll get one or two more. Do you recommend interventional radiology without surgery for the thyroid gland? So a couple of thoughts. So interventional radiology for the thyroid, the main thing there is that there's radioactive ablation that's done. That's the most common one. As far as a treatment, there's certainly diagnostic radiology that's done, but as far as a treatment, the main one is radioablation. And that's done when one wishes to destroy some thyroid tissue. So that can be Graves, that can be toxic nodular goiter, that can be thyroid cancers. In the case of Graves or toxic nodular goiter, my impression is that there are times in which doctors will turn to that prematurely. Not always. There are times where it's completely indicated. But the largest percent of people do respond to other treatments to slow the thyroid. And if they are treated effectively, they don't need those treatments long term. Now, there are those to where those treatments do not work. Their thyroid will not slow down, or it will not stay slow without the most extreme doses. And there are times where it's certainly appropriate, but not always. Jean, thank you so much. Foothills Professional Pharmacy is the proper name. Yep, that's the full name. And they are in Mesa. I didn't give that name very accurately. So Foothills Professional, thank you for having my back, Jean. I appreciate that. Okay, a couple more follow-up comments. I'll get one or two more here and then off to get working in the kitchen. This is about the DHEA. I have dropped it from the progesterone capsule on 2 milligrams of progesterone. Do take it nightly along with the compound estrogen in the morning. Kim, 2 milligrams of progesterone? That's odd. That's not a therapeutic amount by any means. I don't know the indication for it, and I don't know if it's necessary for you. But if someone did need progesterone, the dose range is rarely below 50 milligrams. It's pretty common to see 100 is the most common dosage. But yeah, 50 to 200 are the most common dosing ranges. I don't know that there'd be any effect whatsoever from 2 milligrams of progesterone. So just for what it's worth, that's an odd thing. That would be a very unusual small amount. Okay, let's grab one or two more from over here. Yeah, more good ones. So here's what I mentioned before. I take the right form of vitamin D, and I have tried different ones, but I can't really get it above 40. Is there a trick to it? Kathy, good question. If you want to plug in the dosage you've taken, happy to mention that. Oh, Tiffany, I asked a question 2 weeks ago regarding hypopituitarism. Tiffany, if you wouldn't mind throwing some more detail up, I will keep an eye out for that right now today and see if I can't give you a good in-depth answer. I don't remember the question. I don't have that on hand, but if you can put that back up, I will address that one before we're done today, assuming you put it back up promptly. I won't stay here till midnight for it, but I'll stay here for a bit. So Kathy's on 5,000 units of vitamin D. So Kathy, if you're at 40 and you're talking about milligrams per mil, mg per mil, as opposed to, I'm floundering on nanomoles per liter. Yep. Micrograms per mil versus milligrams per mil versus nanomoles per liter. If you're talking about milligrams per mil in the units, that's awesome. It's not common to have your test done in nanomoles per liter. That's more common outside the US. But if you were, then 40 would be deficient. But milligrams per mil, that's a really good number. Somewhere between upper 30s to low 50s is ideal. And there are many, Kathy, that do tell you need to have your scores higher. And what I've found is that in most cases, those who say that, they end up referencing the other units, the millimoles per liter. And that's units done outside the states. Now, a lot of research articles reference the larger units, the 2.5 times higher, but the labs in the US don't use those units. So in most cases, when someone is saying you need your vitamin D at like 80 to 100, they're talking about different units. But in the units we standardly get our blood tests in the States, that's really going to be more like 30 to 50. Let me see if I can find one of my posts to share with you real quick here, Kathy. I've written about that whole issue in some detail. And yeah, here we go. And I did talk about the whole confusion with the units as well on this one. Let me go up and get this posted. Okay. I will post this right when we're done. But Kathy, if you just Google Alan Christensen vitamin D, it's the very first one that pops up. So really straightforward. And I saw another one. Okay, so Tiffany, husband had a pituitary tumor that hemorrhaged 3 years ago. He's been on hormone replacements for thyroid and steroids for adrenals and testosterone. These meds don't work and he has no energy, now has heart failure. Tiffany, yeah, there was a question we had earlier today about the use of growth hormone. And I mentioned briefly in response to that question that there are those that have almost no pituitary function remaining, and they need growth hormone and really everything else their pituitary would call for. So, to give a recap for those that may not have heard this before, the pituitary tells all of your glands to work. Your thyroid, your adrenals, the ovaries, your testicles, they do nothing unless the pituitary tells them to. So if the pituitary doesn't tell them to work, they don't work, and there's almost no hormone coming out. And in those cases, people need all their hormones replaced. And I don't know what all he's on. I wish I could give a simple answer for this one, Tiffany. In some cases, one of the couple common things I see, some cases they do neglect growth hormone. And some people do need growth hormone in those situations, and that can be a big part of their health and their well-being. So that's measured by IGF-1. IGF-1 is insulin-like growth factor 1. The liver makes that in response to pituitary growth hormone output. Now, the growth hormone is in your blood for such short periods of time, you can't accurately measure it directly. But IGF-1 is stable throughout the whole day, so an IGF-1 level can indicate growth hormone status. And Tiffany, if his were way under 50 in the context of other findings, that may be one more hormone that's not being covered. Another thing I see commonly missing is one called Florinef. That's the medicine name. The hormone's called Aldosterone, and that's one of the ones the adrenal glands produce. So sometimes people don't make enough of it, and that can also be part of symptoms. That can be part of symptoms, especially if there's low blood pressure with heart failure. So sometimes aldosterone may not be compensated for. So really, Tiffany, it comes down to how close are all these hormones mimicking what his body would do normally? And those are two that I commonly see lacking that you didn't mention. Maybe he's on those, but I see a lot of people that are on treatment for hypopituitarism in which they're just not covered. They're not part of it. DHEA can come under that list as well. But those are a couple things to think about. He's on prednisone and levothyroxine. Yeah, so prednisone, there's no perfect replacement for the adrenal cortisol output. There's the glucocorticoid effect and the mineralocorticoid effect. So prednisone is a glucocorticoid. There's a slight advantage of dexamethasone or hydrocortisone over prednisone. And I'm not saying, I wish there was numbers I could put on this. I'm not saying it's like a slam dunk to where one is great and the others are awful. They're all kind of close. But for many people, dexamethasone or hydrocortisone can be a little better tolerated. And in some cases, they work better with the aldosterone as well. So that's just one thought. They're a little closer to a physiologic norm. There are times in which, in unusual cases, prednisone can be a better fit. So I don't want to play armchair quarterback to another doctor who's thought these things through. Yeah, so hydrocortisone. So sometimes dexamethasone is better tolerated than the other two. That can happen. But there's a few things to think through, and for sure that's a very complicated thing. So a couple things to run by the doctor, though. All right, good to see you guys. Happy Monday afternoon. I expect to be traveling. We've got the holidays coming up, so I'll be out for a few weeks. I'll be watching on social media, watching for comments, watching for questions that come up. I won't have live going on next week. I hope you guys have a beautiful holiday season, and thanks for hanging out, and I'll see you again really soon. Bye-bye.